Hello, my name is Angela Westover, and this presentation titled Incorporating Computer Ergonomics Education for Nurse Health and Safety is to serve as my clinical assignment 1 for Purdue Global University MN 590. Let's take a look at the proposed change of incorporating computer ergonomics education for nurses and why this change should take place. Ergonomics is concerned with the design of systems related to how the individuals interact with its parts, such as the use of equipment, performance of job functions, and the overall workplace environment in order to optimize human performance and well-being. Ergonomics can be applied in many ways, including the use of computer technology. Hills provides that sitting at a computer is more physically demanding than it appears and has actually been linked to serious musculoskeletal disorders, which range from minor aches to serious debilitating injuries. The body positioning and motions in the use of computers can contribute to cumulative trauma disorder and repetitive stress injuries such as carpal tunnel syndrome, back pain, osteoarthritis, tendinitis, tendinosynovitis, and/or pitcher, golfer, or tennis elbow. Healthcare technology, including regular computer use, is increasingly being incorporated into the nursing profession. Unfortunately, evidence has demonstrated that there is a high rate of preventable musculoskeletal injuries among nurses. Several surveys have provided that nurses are aware of the many occupational hazards which exist in their workplace, causing musculoskeletal disorders, but rarely do they consider the impact of computer use. It has also been found that not only do nurses generally have low levels of knowledge in workplace ergonomics, but overall, healthcare workplace ergonomics tend to be poor or has several areas for improvement. Expanding ergonomic education to incorporate nursing computer use can contribute to a reduction in musculoskeletal disorders and therefore improve their health and safety. The targeted group for this change is nurses of all specialties throughout their healthcare organization that utilize computer workstations for any work purposes. These individuals should also be involved in the change process, along with nursing administration, nurse educators, occupational health, nurse leaders, and information technology personnel. Some of the things that may serve as significant barriers or limitations to implementing the change would include a lack of support from any of the persons that should be involved in the change process, as listed on the previous slide. Variations in equipment throughout the organization may include devices not being adjustable or devices being shared amongst multiple users. Time or work may pose an issue for delivering or completing the education, or it may also hinder individuals from properly implementing the information they learn, such as in emergent situations or, again, having to share devices. Some of the things that may serve as facilitators or strengths to implementing the change would again relate to those persons that should be involved in the change process. With the support of administration, necessary policies and procedures can be created. The educational team will be required to provide accurate and ongoing education and evaluations of understanding. The occupational health team will be essential in health promotion, which should not only include general wellness, but also fitness. They will also have a role in determining the extent of injuries as a result of the problem. In addition to IT support, assigning equipment specialists, or super users, so to say, can be a unit-specific resource for success. Nursing leadership should support a culture of safety so that all nurses of all specialties throughout the healthcare organization can maintain positive attitudes about incorporating the change. Here we will examine the feasibility of this project. The first step is that there has been recognition of the problem and its impact on the targeted population. Alternative solutions have been considered, and this includes not incorporating such training, replacement of all of the required equipment, or just providing only informational material rather than requiring education. Consideration of alternative solutions also includes reviewing the different methods of instruction such as printed reading material, audio-visual presentation, or in-person lecture and demonstration. A review of available and other applicable literature was conducted and provided some insight as to how other organizations have implemented similar projects and whether or not there was success in that solution. The next step was then to choose the preferred solution with consideration to time and cost. An online learning module with audio and video is determined to be a preferred solution, which would be most feasible to implement within a large-scale healthcare organization at lower cost, and it has the lowest risk as well as highest confidence for delivery when dealing with such a wide variety of specialty areas to reach in the target population. In conclusion, the following preliminary PICO has been developed. Do nurses who receive computer workstation ergonomics training have less complication than those who do not receive the same training? Again, the population is nurses of all specialties throughout the healthcare organization that utilize computer workstations for any work purposes. The intervention is the incorporating of computer ergonomics education. The comparison will be to nurses who do not receive the same training. And lastly, the outcome will be limiting the related complications such as musculoskeletal injuries. The time frame for this has not been determined. Thank you for listening, and I'm excited to move forward with this project.